Okay, so if you spend any time at all on TikTok, you've definitely seen this whole wave of anxiety around something called advanced maternal age. It's a topic that can spiral really fast, from, funny jokes to just genuine fear. So in this explainer, we're going to separate the actual medical facts from all that social media panic.
And this is really the big question, isn't it? It's the one that's kind of lurking behind all those scary videos and all the cautionary tales online. It gets framed like you hit 35 and just fall off this terrifying cliff. But is that what the science actually says? Let's unpack that.
And this is the kind of stuff that just pours gasoline on the fire. This is a real claim from a real video about being pregnant at 38. A 50-50 chance of dying. I mean, it's extreme, it's super alarming, and it is exactly the kind of misinformation we need to talk about. So let's get into the reality behind all the rhetoric.
All right, so first up, we have to understand where all this anxiety is even coming from. The whole conversation online has created this very real culture of fear around having kids after a certain age, and it seems to bounce between two extremes.
So on one hand, you've got the funny, relatable stuff, right? Like joking that the sound of your knee cracking is what woke the baby up. But then, on the other hand, you have people who see this stuff and feel this genuine sense of dread, saying it actually makes them nervous to even try to become a mom. And it's that wild mix of jokes and fear that creates such a confusing and honestly a stressful environment.
So, let's get to the idea that seems to be right at the heart of all this panic, this so-called fertility cliff at age 35. This is the whole notion that your ability to have a healthy pregnancy just completely plummets overnight. But we really need to look at the actual numbers.
Yeah, it's a kind of funny-sounding word, fecundability, but it is the key medical term we need to wrap our heads around here. Basically, it's not about whether you can get pregnant, it's just the statistical probability of it happening in any 1 month. And this chart just lays it all out so clearly. When you're in your 20s, your chance of getting pregnant in any given cycle is about 20 to 25%. After you turn 35, that number drops to around 15%. So yes, it's a decrease, but look at that. It is absolutely not a drop to zero. It's a decline, not a disaster.
So here's the absolute biggest takeaway. It's a gradual change. Your body doesn't just hit midnight on your 35th birthday and suddenly stop working right. The challenges and the risks increase slowly, year by year. It is a spectrum, not a clef.
Okay, so what about those really intimidating terms? I mean, why on earth would a doctor use a word like geriatric when you're just trying to have a baby? Let's break down the language. First things first, geriatric pregnancy. Look, that's an old, super outdated term. Most of the medical community has moved away from it because, let's be honest, it's unhelpful and it's offensive. The term you're much more likely to hear now is advanced maternal age, which is just the medical way of acknowledging that certain risks do start to gradually go up after 35.
And this is so important to get. The intent behind these labels isn't to make you feel bad. They're a clinical tool. Doctors use them to basically sort patients into different risk categories so they can make sure everyone gets the right level of monitoring and care. It's really just a functional tag, not some kind of personal insult.
You know, we live in an age where there's an app for everything, right? But when it comes to fertility, your tracking app just doesn't have the whole picture. And honestly, relying on it too much can be a little misleading.
Think about it. An app is just making an educated guess based on what your body has done in the past. But your body isn't a machine. You can ovulate early 1 month, late the next. And even those ovulation predictor kits, or OPKs, they're not foolproof. You can get a false positive, especially with conditions like PCOS, or you could get a false negative just by testing at the wrong time of day. So they're not the be-all and end-all.
This is the key question, right? With all this uncertainty and tech that can be kind of misleading, when is the right time to stop guessing and actually go get professional advice?
Luckily, the medical guidance here is actually super simple and really easy to remember. If you're under 35, the recommendation is to talk to a doctor about a fertility evaluation after you've been trying for 1 full year. If you're over the age of 35, that timeline gets shorter, just 6 months. It's a really straightforward rule of thumb that helps you know when it's time to take that next step.
Okay, so let's bring all of this full circle. It's time to move beyond this fear-based story and really look at the whole picture. The risk, the reality, and yeah, the rewards that often get completely overlooked.
Remember that absolutely terrifying claim from the beginning? The one about having a 50-50 chance of dying? Well, the medical response to that is, it's not 50-50. It's not even close. You do not have a coin flip's chance of dying in pregnancy just because you're 38. That is a massive and frankly irresponsible exaggeration. The real story,
as we've seen, is just so much less dramatic. It's a gradual, year-by-year increase in certain risks. You don't just wake up one day and become a problem. It's a totally manageable reality that you and your doctor can navigate together.
And this really gets to the core of why so many people are frustrated. They feel like they are just constantly bombarded with all the negatives. They know the risks. They've heard them 1,000 times. What they're asking for is a more balanced conversation. What about the other side of the story?
And guess what? There is another side to this story. For example, one study found that women who give birth after the age of 40 were 4 times more likely to live to be 100. Now that's an interesting statistic, isn't it? It's exactly the kind of positive counter-narrative information that is so often missing from this entire discussion.
So that really leaves us with one final thought. The whole story of motherhood later in life has been just dominated by fear and really outdated terms. So, given the medical realities and all of the positive perspectives we're missing, maybe it's time we all start telling a more complete, a more balanced, and a much more empowering story.